My name is Dorcas Akeju. I'm a retired midwife, and also I was the lead for equality and diversity for my trust when I was working. I joined the clerk in 2015, and before it becomes the ARC. My role at the moment is a public advisor as well as co-lead for HACA, which is F&K, a progress course team. I joined the HACA team because I like the vision about pregnancy to the end of life. I've been able to make a difference to my team, supporting them in reaching out to the public and also the communities and bringing different angles of suggestions when we are having discussion about research and projects. I've also been able to bring points of view to the table from the beginning to the development of a piece of research and project to the end, ensuring good co-production and effective collaborative work. I've used my knowledge of public participation, involvement, and engagement to help my team as well and to help us. And I've used my knowledge of equality and diversity to look into research paper identifying inequalities. I've been involved in a lot of projects, really. I supported the PhD students doing research on mental health amongst the BIM communities, which is Black and minority ethnic group. I'm also interested in domestic violence against women, and I really wanted to do like a research on it, but because we've got Vista, which is also a project looking into integrating social care in response to intimate partner violence and abuse, supporting the women and family. So our ARC joined another 4 ARCs, really. So I'm a member of that, which is quite good. The main objective is to identify support services available for families who have been involved in domestic violence. And I think this is important because women sometimes they don't say anything, but they need that support. And also another project that I'm involved with is to do with infant feeding. With F research, really, I'm interested in research, and I've done a research myself when I was doing my master's. I did my own female genital mutilation because I'm passionate about it being stopped there. But F research is important because it provides that vital information about ailment, for instance, the cause, the risk factors, and the trends. So if we embed research into community, that gives patients wider treatment and options, treatment options. Until organization can get the level of understanding and the barriers that underprivileged faces, research will not work. They need to understand the barriers of these communities. There's a strong focus on involving people with life experience and policy as well, and those that are in practice, because we have to involve everybody when you want to do research, because that's important, because that will strengthen the equity of the research. It is about involving the communities and patients, and that the outcome of the research will be affected. I have been involved in different researches and since joining the CLAC and the app. The first one that I joined was the wider, is called the well-being place perception scale, structure, validity, ability, and correlates during COVID times. And that's by Ryan Cochrane, who is one of our professors, really, and I'm a co-author. She's put me on it. Mental health stability during COVID-19 by Kathleen Gomez, and also involved in a study which is done by the City Council, looking into services, access to services, social care and health care within Liverpool. And because I'm a Black elder, I was asked to comment on it, I was asked to say something, and I organized a focus group for Tracy Gore, who is the lead for this research, and it was funded by Liverpool City Council. I have been volunteering as a community person for a long time, over 25 years now. And I've set up a lot of initiatives such as an FGM group when I was working, and the BAME Women Advisory Group as well. And I also set up the African Elders. But I sit on social care and F scrutiny panel for Liverpool City, which is quite good as the equality advisor, because if there is a topic, I can, although I have no vote, I'm not a councillor, but I can tell them that if you look at this, if you look at that, because it's important to have somebody there to support them. I'm a trustee also for the Liverpool voluntary community sector, LCVS as well. Also, I'm a governor for the Liverpool University Foundation Trust Teaching Hospital. So I'm quite busy really, and I find time to help my community. I do a lot of arrange talks for my community group. I'm a Yoruba woman originally, and I speak Yoruba, so I speak Yoruba language. And you can see the way I dress. This is the Yoruba outfit, really. So the panel, I just, help my community, encourage them to participate in research, empower them to ask questions, because some of us, we don't ask any question, really. And I do help support the disadvantaged women and families at Akeju, which is a refugee home for women that have gone through domestic violence or women that have had FGM, female genital mutilation. And I do organize talks on mental health, cancer, stroke for my community, and diabetes, because that's quite common amongst Afro-Caribbean. I am a soroptomist, and I'm proud to say I am a soroptomist. Soroptomist is a women organization, and our vision is to help girls through education, empowerment, and also to enable opportunities. And in 2018, I was the president of my club. And then 2021 to 20, I was the regional president for Lancashire. As a co-founder for Breed Easy Foundation, Breed Easy Foundation was set up in memory of my daughter, who died in 2009 of asthma in Nigeria. And when she died, there was no nebulizer, there was no oxygen. And that makes me and my husband to say we can use our grief in a different way to support others. And that's what we've been doing since 2014. And we've only just come back from Nigeria, and we donated a lot of nebulizers to 2 teaching hospitals, but they're taking some to the villages as well. So we're doing something, at least how we feel. If 1 or 2 lives are saved in a year, that's something positive. What does equity mean to me? When Sharon asked that question, I thought, what does it mean to me? To me, it's about fairness and justice. Because if there is no fairness and justice, what's happening? For a lot of women, they don't have that chance. They don't have voice enough. And that's why the International Women's Day should be celebrated by all women all over the world. And for those that are underdeveloped world, that are not developed world or developing world, women there that cannot speak for themselves, we can use that to empower the women. And that's why I'm in support of International Women's Day. Thank you so much for listening.